Welcome back to Dead Reckoning, the Human Life Expectancy channel. Today we'll consider the question, how will you die? Despite the fact that death is both certain and eternal, most of us spend less time thinking about how we'll actually die than we spend planning our upcoming vacations. What thinking we do is often ill-informed and haphazard. To start, many people prefer not to remind themselves of their mortality and don't think about death at all. Then, even when we are brave enough to confront it, we tend to learn of the ways that people die through the experiences of our friends and family and through the news media. And at the risk of stating the obvious, neither is a reliable indicator of how people actually die. Your friends and family may not be representative of the larger population, and media can be even worse because of its systematic negative bias. The rule in media is, if it bleeds, it leads. Or as cognitive scientist and author Steven Pinker put it, quote, "News is a non-random sample of the worst things that happened on Earth the day before." And good news often simply doesn't make the cut. Economist Max Roser points out the fact that, quote, 137,000 people escaped from extreme poverty every day for the last 30 years never makes it to the headlines. In addition, history books, statues, memorials all tend to emphasize military victories over less flashy but higher impact technology advances, such as sewers, synthetic fertilizers, GMO foods, and medical advances such as vaccines, antibiotics, epidemiological discoveries, and public policies on water treatment and pasteurization, all of which saved even more lives. Sometimes thinking about death comes in random flashes. If you're like me, perhaps you're sitting eating breakfast or maybe in the shower and boom! Suddenly you're thinking about how you'd respond to a shark attack or some other horrible predicament. This happens to many of us. Our brains evolved to envision potential risks and prepare how we might respond. On the positive side, this seemingly involuntary consideration has helped us to survive. This compulsive analysis of the risks we face is at least partially responsible for the fact that we're the most dominant species on planet Earth. You'd be right, however, to question whether this vestige of our evolutionary past is currently very helpful or even relevant. The problem is, as our brains evolved from 1 pound to 3 pounds over the last 2 million years, the potential causes of death have changed dramatically. Our brains evolved to be particularly wary of people and animals that might attack us. However, we've been less than stellar at figuring out which animals are truly dangerous. For example, today, sharks kill 10 or so people every year, while mosquitoes kill about 725,000, 73,000 times more. But how many of us actually have mosquito nightmares or plot elaborate mosquito avoidance maneuvers in the shower? Today, the likelihood of being killed by an animal or another man is a fraction of what it was in the past and is vanishingly small compared to the odds of dying from overeating, failing to exercise, smoking, or other unhealthy behaviors. We're left with brains that evolved to avoid betrayal, attack, and clear short-term risks, but living in a world where increasingly what kills us is not other people, animals, or short-term sensational deaths, but our own long-term behaviors and other less overt factors. To help us live longer, shouldn't we focus more on the things that actually kill us? It's time for some dead reckoning. While your specific death is a function of your genes, your behaviors, your environment, and your luck, and is therefore unknowable, across the current population, how we die today is actually very well understood from a probabilistic and mathematical perspective. Insurance actuaries live for this stuff. Their job is to predict actual mortality, so they've developed processes that remove the sensational and the subjective. So, here's what we know about how we die today. Currently, about 55 million people die per year around the globe. That works out to about 150,000 people per day, or about 17 people per second. That's a lot of deaths. So right off the bat, this means that something must cause 550,000 deaths per year to be responsible for even 1%, or 55,000 deaths per year to be responsible for even 0.1% of all deaths. It's not that individual deaths don't matter, of course they do, but we're looking at the major things that kill us, as dead reckoning requires. Causes of death have to be pretty large to move the needle. Overall, global HLE improved 6.6 years between 2000 and 2019. This corresponds to a reduction in overall death rates of 14% over those 19 years. Deaths are grouped into 3 categories. The first category is non-communicable diseases, or NCDs, that are responsible for about 74% of global deaths. NCDs are diseases such as heart disease and cancer that can't be transferred from one person to another, so you needn't worry about catching them from others. However, many of them are driven by behaviors such as smoking and overeating and lack of exercise, which can spread across populations in ways that are not dissimilar to the ways that communicable diseases spread. NCDs tend to kill us late in life, with an average age of death, or AOD, of 72 years. The overall death rate for NCDs increased 4% between 2000 and 2019, as decreases in strokes, COPD, cirrhosis, and congenital anomalies were more than offset by increases in heart disease, cancer, Alzheimer, and diabetes. However, since NCDs largely kill the old, and since the global population is aging, the age-adjusted rates of growth for many NCDs is actually falling. The second major category is communicable diseases, or CDs, that currently account for about 18% of global deaths. They're driven by transferring, or communicating, some sort of parasite between humans or other animals. Parasites are organisms, of course, that survive by feeding off of host organisms, and there's many types, including worms, protozoa, bacteria, and viruses. The average age of death, or AOD, is 35 years, and CDs tend to kill the very young whose immune systems have yet to develop, and the very old whose immune systems are failing. Between 2000 and 2019, the death rate for CDs fell an astonishing 48%. This extraordinary progress was largely driven by 4 factors. First, increased access to clean water. Second, effective use of mosquito netting and other barriers that prevent parasitic conditions, such as malaria. Third, increased knowledge and availability of antibiotics and other drugs that treat and cure CDs. And fourth, continued progress in preventing neonatal diseases. However, about 1/5 of this progress was offset by the coronavirus, or COVID, infection in 2020. The disease has been horrific, killing approximately 1.9 million people around the globe in 2020 and slashing trillions of dollars of wealth from the global economy. So far, it's resulted in global death rates of 25 per 100,000 people per year, with an overall reduction in HLE of 1 to 2 years. While horrific, its death rate is still less than 1/6 the rate at which we die of heart disease, for comparison. The progress was also partially offset by climate change, as warmer, more humid conditions advanced waterborne and insect-borne communicable diseases. The third category of causes of death is injuries, which include all forms of traumatic physical damage. Injuries are responsible for about 8% of 2019 global deaths. Data on injuries is grouped by whether the injuries were unintentional, for example, from falls, accidents, and road injuries, or intentional, from suicide, violence, or war. Accidents hit all ages more or less equally and have an average age of death of 47 years. The death rate from injuries fell 20% between 2000 and 2019 as wealth, regulation, and continuous risk reduction efforts continue to pay off. Let's now become better acquainted with the 26 major causes of death that are collectively responsible for almost 98% of global deaths, so chances are very good that you will die from one of these conditions. We'll start with the top 12 NCDs, then cover the top 10 CDs and the 4 categories of injuries. The stories behind each of these causes of death are truly fascinating. They're filled with discovery, setbacks, and triumph, but unfortunately telling them would take many volumes. So instead, we're going to describe each cause of death to lay out the groundwork for how it might be impacted by technologies and medical advances that we're going to discuss in future videos. Fair warning, we're going to include pictures of people experiencing each cause of death, but are not gory or from medical journals, to help you quickly understand and remember each. However, if you'd prefer not to spend the next 10 minutes reckoning so closely about death, please feel free to use the chapter markings below to skip to the How You Will Die section at the end of this video. So let's go, starting with non-communicable diseases. Heart and circulatory diseases are the largest single cause of death around the globe, responsible for 21.1% of all deaths. The most common types of heart disease are ischemic heart disease, also known as coronary artery disease or coronary heart disease, which involves the reduction of blood flow to the heart muscle due to a buildup of plaque in the arteries of the heart. Hypertensive heart disease, which includes a number of complications of high blood pressure that affect the heart, and rheumatic heart disease, which involves the inflammation of the heart due to rheumatic fever. Other circulatory diseases include mitral valve prolapse and arrhythmia. Cardiovascular disease has an average age of death of 65 years, and it becomes much more likely with age. The average annual rates in the first cardiovascular events rise from 3 per 1,000 men at 35 to 44 years of age to 74 per 1,000 men at 85 to 94 years of age. For women, comparable rates occur approximately 10 years later in life. The death rate from heart and coronary diseases increased 5% between 2000 and 2019. Ischemic heart disease accounts for almost half the increase in the number of cardiovascular deaths, but death rates due to hypertension are also increasing. A number of factors contributed to this increase. First, people are living longer, and older people are at higher risk for heart disease. So, when statistically controlled for these factors, the age-standardized heart disease death rate actually went down. Another factor driving this increase is worldwide obesity, which is reaching epidemic proportions. Since 2000, the global age-standardized prevalence of obesity among adults 18 years and older has increased 1.5 times, and the crude prevalence of children aged 5 to 19 has more than doubled. Since 1975, the worldwide prevalence of obesity has nearly tripled. On the positive side, we seem to be making some progress in preventing heart disease by changing our behaviors. Smoking, which is a major cause of heart and circulatory disease, has fallen slightly over the last 20 years. Physical activity has stayed relatively constant, but unfortunately at a low level. One study of 1.9 million participants found that approximately 27.5% of people had insufficient physical activity in both 2001 and 2016. The second largest cause of death is cancer, which is responsible for 16.8% of global deaths. Cancer is a family of diseases caused when the genetic system in a group of cells causes them to grow uncontrollably and become parasitic, feeding on the host organism. Cancer activates a molecule called CLTA4, which causes the T cells, which are the first responders of the immune system, to turn off, allowing for uncontrolled growth. These cells group together in malignant tumors that can eventually spread throughout the body in a process called metastasis, resulting in death. The most common types of cancer are lung, colon, breast, skin, and blood. They all occur in tissues where the cells divide rapidly and therefore pick up more genetic mutations. There's many different types of cancer, with 5 types: lung, stomach, colorectal, liver, and breast, responsible for over 50% of deaths. Cancer has an average age of death of 69 years, and cancer risk also increases with age, peaking in men and women in their 80s. Almost 90% of all people who die from cancer are 50 or older. The death rate from cancer increased 9% between 2000 and 2019. However, as with heart disease, the total number of cancer deaths and the death rate from cancer have both gone up largely because of population growth and aging. When controlled for these factors, the age-standardized cancer death rate actually went down. Cancer survival has also improved significantly since the 1970s for many reasons. Advances in diagnosis, where catching cancer early greatly enhances the probability of survival. and advances in treatment, where 5-year survival rates across all types of cancer have increased from 49% in 1975 to 67% today. Strokes are the third largest cause of death, responsible for 11.2% of global deaths. A stroke occurs when a blood vessel in the brain is either blocked by a clot or bursts. When that happens, the cells in parts of the brain that cannot get the blood and oxygen they need die, causing a loss of functionality and sometimes death. Strokes generally kill older people and have an average age of death of 74 years. The death rate from strokes fell 10% between 2000 and 2019 due to hypertension treatment control efforts, including lifestyle changes such as diet, exercise, and quitting smoking, and the use of pharmaceuticals to control hypertension, diabetes, and excess fats in the blood. 80% of strokes are considered preventable through behavioral changes, early diagnosis, and hypertension and use of appropriate pharmaceuticals. Chronic obstructive pulmonary disease, or COPD, is responsible for 5.8% of global deaths. It's a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus production, and wheezing. It generally kills older people and has an average age of death of 79 years. More than 90% of COPD deaths occur in low and middle income countries, and about 75% of COPD cases come from exposure to tobacco smoke, either active smoking or secondhand smoke. Other risk factors include exposure to indoor and outdoor air pollution, and occupational dusts and fumes. Cooking fuels used by 40% of humanity, including wood, charcoal, animal dung, crop residues, and coal, resulted in household air pollution that's responsible for 4.3 million premature deaths each year from COPD and other conditions. The death rate from COPD fell 14% between 2000 and 2019 due to reduced tobacco smoking, air pollution in the home and at work, as well as declining poverty levels and improved access to healthcare in most countries. Alzheimer disease and other dementia accounted for 3% of global deaths. Alzheimer disease is a progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out even simple tasks. It kills people later than any other disease we cover at an average age of 84 years. In most people with the disease, those with the late onset type, symptoms first appear in their mid-60s. The probability of getting Alzheimer's disease increases with age, and 32% of people aged 85 and over in the U.S. have it. The death rate from Alzheimer's disease and other dementias increased 124% between 2000 and 2019. However, as with heart disease and cancer, this increase is due to population growth and aging. Controlling for these factors, and again, this rate is actually declining slightly. In addition, other neurological conditions, which are responsible for 1% of 2019 deaths, which also primarily affect the old, increased 30% between 2000 and 2019. Alzheimer's disease is likely caused by the buildup of misfolded proteins in the brain, impairing normal brain functioning. It's thought that this buildup is caused by the failure of the chaperone system, where proteins are guided into their 3D structures by helper molecules, and the failure of the brain to remove misfolded proteins. Alzheimer's disease also has a high genetic component, with 70% of the deaths linked to 20 or so gene variants. The remaining 30% is caused by environmental factors such as obesity, poor diet, and insufficient exercise. Alzheimer's disease has been linked to diabetes because both have high correlation with poor diet. Diabetes was responsible for 2.7% of 2019 deaths. It occurs when blood glucose, also called blood sugar, is too high. Insulin, a hormone made by the pancreas, helps glucose from food to get into your cells to be used for energy. Metabolic derangement and other conditions can cause you to have too much or too little insulin in your blood, resulting in diabetes. There are 3 forms of diabetes. Type 1 is mostly genetic in origin, and it results in the pancreas's inability to produce insulin, manifests early in life, can be medically controlled by insulin, and cannot be reversed. Type 2 diabetes, which is responsible for 90% of the diabetes cases and affects 450 million people worldwide, 8% of the global population. It's primarily caused by obesity and lack of exercise, begins with insulin resistance, and can be reversed with lifestyle changes, including diet and exercise. The third type is gestational diabetes, which occurs in pregnant women, which is much less common and often reverses after birth. Diabetes causes multiple medical conditions, including cardiac disease with damage to blood vessels twice as prevalent, strokes, kidney failure, cancers, foot, eye, and other problems. Diabetes has an average age of death of 72 years and also gets more likely with age. Overall, the average 50-year-old diagnosed with diabetes dies 6 years earlier than those without the diagnosis. The death rate from diabetes increased 36% between 2000 and 2019. The major factor driving this increase was worldwide obesity, which triggers type 2 diabetes and, as we mentioned under heart disease, is reaching epidemic proportions. Another risk factor is smoking. Smokers are 30 to 40% more likely to develop type 2 diabetes than non-smokers. Kidney diseases kill about 2.4% of us globally. Diabetes is the main cause of chronic kidney disease, but there are other causes, including hypertension. It also generally kills older people and has an average age of death of 70 years. Cirrhosis of the liver kills about 2.4% of us. Cirrhosis is a late-stage scarring of the liver caused by many forms of liver disease and conditions, such as hepatitis and chronic alcoholism. As cirrhosis progresses, more and more scar tissue forms, making it difficult for the liver to function. In addition to cirrhosis, there are a number of other digestive diseases, including paralytic ileus and intestinal obstruction, peptic ulcer disease, pancreatitis, and gallbladder and biliary disease that are responsible for about 2.1% of global deaths. Also, other respiratory diseases, including asthma, accounted for 1.6% of deaths in 2019 and fell 7% between 2000 and 2019. Neurological conditions account for 1.2% of global deaths and include conditions such as Parkinson's disease, epilepsy, and multiple sclerosis. Congenital anomalies account for 1% of global deaths. They're often inherited medical conditions that occur at or before birth and result in death at an average age of about 6 years. The most common severe congenital anomalies are heart defects, neural tube defects, and Down syndrome. Let's now have a look at the top 10 communicable diseases, or CDs. The largest CD is lower respiratory infections. They're responsible for about 4.7% of global deaths. So there's about a 1 in 20 chance that this is how you're going to die. Lower respiratory tract infections include pneumonia, bronchitis, and any other infection in the lungs below the voice box. Influenza is a common cause of lower respiratory tract infections. Lower respiratory tract infections can affect the airways, as does bronchitis, or the air sacs at the end of the airways, as does pneumonia. Lower respiratory infections have an average age of death of 53 years, but tend to kill the very young who have not yet developed strong immune systems and the very old whose immune systems are weakening. The death rate from lower respiratory infections fell 32% between 2000 and 2019, pre-COVID, largely due to advances in prevention such as increased breastfeeding and nutrition, which helps infants' immune systems, immunization, and reduced indoor air pollution, and advances in treatments, including greater access to antibiotics. Even with COVID and its death rate of approximately 25 per 100,000 people per year, the lower respiratory infection rate likely fell in 2020. Neonatal conditions account for 3.7% of global deaths. These include preterm birth complications, birth asphyxia, and birth trauma, neonatal sepsis, and other conditions that occur at the very beginning of life. While you no doubt have personally escaped these risks, from a humanitarian perspective, you should know that approximately 2 million babies still die this way every year, especially since these deaths are largely preventable. The good news is that the death rate from neonatal conditions fell 49% between 2000 and 2019, largely due to increased levels of medical care during pregnancy and birth. In addition, due to greater access to medical care and vaccines, the death rate for childhood cluster diseases, which includes measles, tetanus, whooping cough, and diphtheria, which were responsible for 0.6% of 2019 deaths, or about 330,000 deaths a year, those fell 71% between 2000 and 2019. And the death rate for nutritional deficiencies, which were responsible for 5% of 2019 deaths, disproportionately affect the young, but they also fell 53%. Diarrheal diseases cause about 2.7% of global deaths. Diarrhea is caused by a host of bacterial, viral, and parasitic organisms, most of which are spread by feces-contaminated water. Rotavirus and E. coli are the two most common etiological agents of moderate to severe diarrhea in low-income countries. Diarrheal diseases have an average age of death of 48 years, but again tend to kill the very young, who have not yet developed strong immune systems, and the very old, whose immune systems are weakening. The death rate from diarrheal diseases fell 54% between 2000 and 2019 due to improved sanitary conditions and increased knowledge and availability of oral rehydration therapy, or ORT, to treat diarrheal diseases. Tuberculosis, or TB, is responsible for about 2.2% of global deaths. It's caused by bacteria that usually attack the lungs, but can also damage other parts of the body. Common symptoms of active lung TB are cough and sputum with blood sometimes, and chest pains, weakness, weight loss, fever, and night sweats. TB spreads through the air when a person with TB of the lungs or throat coughs, sneezes, or talks. Tuberculosis tends to kill middle-aged people and has an average age of death of 41 years. The death rate from tuberculosis fell 45% between 2000 and 2019, largely due to increased treatment with a 6-month course of 4 antimicrobial drugs. However, deaths from new forms of multi-drug-resistant TB are rising and remain a public health crisis and a health security threat. Human immunodeficiency virus and acquired immunodeficiency syndrome, or HIV/AIDS, accounts for 1.2% of global deaths. HIV harms your immune system by destroying the white blood cells that fight infection. This puts you at risk for serious infections and certain cancer, and it has an average age of death of 37 years. The death rate from HIV/AIDS fell 61%, having killed 675,000 people in 2019, down from 1.4 million in 2000. This fall was due to increased access to HIV prevention, rapid diagnosis with same-day tests, and effective treatment with lifelong antiretroviral therapy, or ART, and care. HIV infection has now become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. Just recently, in December 2021, the US FDA approved a long-acting injectable drug for preventing HIV. Malaria is a mosquito-borne communicable disease that affects humans and other animals and is responsible for about 0.7% of global deaths. Malaria causes symptoms that typically include fever, tiredness, vomiting, and headaches. In severe cases, it can cause yellow skin, seizures, coma, or even death. Malaria infections can occur at any age, but are more than 5 times as likely to kill children younger than 5. The mosquito is the most dangerous animal for humans because they carry the Plasmodium genus of parasite, which causes malaria. From a pure dead reckoning perspective, mosquitoes have accounted for more human deaths than sharks, snakes, dogs, scorpions, and all other animals combined. The death rate from malaria fell 55% between 2000 and 2019 due to the expansion of insecticide-treated mosquito netting, indoor residual spraying, diagnostic testing, and artemisinin-based combination therapy. Maternal conditions account for 0.4% of global deaths. They include multiple gestation, preeclampsia, and gestational diabetes, and other pregnancy complications. In addition, the WHO estimates that each year between 4.7 and 13.2% of maternal deaths are due to unsafe abortions. The death rate from maternal conditions fell 59% between 2000 and 2019 due to increased availability of prenatal and reproductive care. A broad range of other infectious and parasitic diseases cause about 1.7% of global deaths. They fell 37% between 2000 and 2019, also due to increased sanitation efforts and improved access to healthcare, vaccines, and antibiotics. We're almost there. Let's now move on to the 4 types of injuries. Data on injuries is grouped into whether the injuries were unintentional, for example, from falls, accidents, and road injuries, or intentional, from self-harm, violence, or war. Unintentional injury, from falls or other non-road related accidents, account for 3.4% of 2019 deaths, and the death rate fell 18% between 2000 and 2019. Road injuries were responsible for 2.3% of global deaths, and the death rate fell 12% between 2000 and 2019 as both cars and roads became safer. Self-harm accounts for about 1.3% of global deaths, and the death rate fell 29% between 2000 and 2019. However, the rate of suicide among men is almost twice the rate among women, and while suicide is one of the leading causes of death of young people, the rate of suicide increases greatly with age. In the US, there have also been recent increases in suicide rates among both teens and middle-aged men. Interpersonal and collective violence is responsible for about 1% of global deaths. And interpersonal violence makes up 87%, with only 13% due to terrorism and collective violence. As we noted, this is a much smaller percentage of deaths than portrayed in the media. The surprising fact is that ignorance and misinformation cause far more death than malice. The number of people who die from war and crime is a small fraction of those that die from preventable, communicable, and non-communicable diseases and accidents. In 2019, this ratio was more than 60 to 1. The death rate from interpersonal and collective violence fell 28% between 2000 and 2019, and the rate of violent crime also reduced. The number of deaths from terrorism is very low and is currently driven by conflicts in Iran, Afghanistan, and Syria. This is part of a much longer trend. Cognitive psychologist Steven Pinker's extraordinarily compelling and thorough book, The Better Angels of Our Nature, concludes that violence is now less than 1/500th as prevalent as it had been throughout human history, even including the wars of the 20th century and terrorism, due to factors that digital technology helps to promulgate: empathy, self-control, the moral sense, and reason. So how will you die? Best to ask your doctor. But based on today's statistics, there's a 98% probability that you'll die from one of the NCDs, CDs, and injuries that we've just mentioned. The highest probability is that you'll die from a non-communicable disease, such as heart disease, cancer, and stroke. Together, these make up almost 50% of the deaths. Add COPD, diabetes, and Alzheimer, and the number rises to 60%. Since the probability of dying from these diseases can all be reduced by eating well, exercising, and quitting smoking, you'll do better to focus on these behaviors than planning futile responses to shark attacks or other violent deaths. The simple, dead reckoning is that for every minute you spend thinking about death from terrorism, you should be spending approximately 1,500 minutes thinking about non-communicable diseases, such as heart disease, cancer, and diabetes, and the behaviors you and others can adopt to reduce them. 400 minutes thinking about how to combat tuberculosis, AIDS, diarrheal, and other communicable diseases. 120 minutes thinking about how to avoid falls and other unintentional injuries. 75 minutes thinking about reducing neonatal conditions. 75 minutes thinking about protecting yourself from COVID. 50 minutes thinking about road injuries and how they could be avoided. 25 minutes thinking about reducing self-harm. And 20 minutes thinking about reducing non-collective intentional violence. Bringing your thinking more in line with this reality can only help you and others to prepare for what lies ahead. Of course, these statistics will change in the future, and our ability to do something about the various causes of death varies widely. It does little good to focus on things we can't change. In future videos, we'll show you that there's much we can and will do to reduce the death rates and potentially increase HLE by at least 10 years in the next 20 years. In our next video, we'll focus on the variation of HLE across the globe and a top-level strategy for enhancing HLE. In the meantime, please hit the like button below, subscribe to the Human Life Expectancy channel to make sure you don't miss our next videos, and post comments for the topics you'd like to have us cover. Thanks for joining us. Till next time, as we say at Human Life Expectancy Inc., hi hua! Please, do what you can to help yourself and help us all to live longer.